start with a very common pharyngitis, and we'll finish up the section with sialadenitis. Something in primary care you see pretty much almost every day. Pharyngitis tonsillitis. It takes up about 10% of all primary care office visits and about half of outpatient antibiotic use. The primary concern is figuring out, though, who most likely has group A beta hemolytic strep because of the possible more serious complications like rheumatic fever and glomerulonephritis. There is also the concern with cost as well as development of bacterial resistance with unnecessary antibiotic use. So just some other quick points here. If you get something in the differential in a question, they are found on non-keratinized mucosa, like the buccal or labial mucosa, not the gingiva or the palate. They are found on non-keratinized mucosa, like the buccal or labial mucosa, not the gingiva or the palate.
We now have an exercise break. I want everybody to put their hands over their head. And now I want everyone to put their hands around their neck. Okay. Phimosis. Phimosis. Say it. Phimosis. Paraphimosis. Okay. I guarantee you, sometime in the middle of the night, when you have somebody with a condition involving their foreskin, you're all going to look at each other and go, which one was the really bad one, where the glands is turning blue and dying? And then you'll remember, phimosis, paraphimosis. Phimosis is bad, paraphimosis will take your head off, all right?
Okay, so here's an x-ray of our hand in somebody who has rheumatoid arthritis. And I don't know if you can really appreciate it, but if you look at this joint here, this PIP, you can see the whiteness or the density of the bone here, as opposed to down here, you sort of see this lucency of the bone in the metacarpal, or around the metacarpophalangeal joints. It's less white than the areas up here, and that's what we call juxta-articular demineralization.
Which of the following has the highest sensitivity and specificity for diagnosing H. pylori? CEA, fecal antigen assay, a serum gastrin level, or a urea breath test? Great, urea breath test, right? The serum gastrin, remember, we would do that for patients with Zollinger-Ellison syndrome, the CEA to monitor the colorectal cancer patients. And again, fecal antigen assay is an option, but the books still say that versus FAA versus urea breath test still has the highest sensitivity specificity. Question? If one of the answers was biopsy, that's what the question is. To do the biopsy, you would have to do endoscopy. The books don't say that you have to do endoscopy to diagnose H. pylori. This is more cost effective. That's a very good question.